Does anyone enjoy pain or suffering? I think most likely not, but it's often something that happens in part of one's life. So I think it's important to learn what we can do, if anything, to minimize this pain or suffering that one experiences, or the pain or suffering that one may inflict on themselves. I'm Dr. Anthony Collada, a board-certified psychiatrist, and in this video I will show how to understand the emotional and psychological aspects of pain a little bit better. So one definition of psychological pain is a form of suffering that is caused by grief or disappointment, such as disappointment from anticipating a reward that would come from an event that doesn't take place. So now compare this to physical pain, which is more multidimensional regarding not only the physical sensations of the body, but also perhaps emotional pain. And you can also distinguish this from social pain, which is like feeling rejected, maybe excluded, maybe separated, or a loss of a loved one. Now, psychological pain can also come from feeling devalued or not feeling like one is being rewarded adequately in life. And this psychological pain can increase the risk of depression, anxiety, can increase stress level. And scientific studies show that being separated from loved ones or a loss of loved ones can lead to sleep problems, which can then affect the immune system, and also speed up the rate of one dying. In children who've experienced parents getting divorced, they find that the hypothalamic pituitary adrenal axis, basically this fight or flight response in their body, is not regulated normally. It's likely overly reactive, even by the time they become adults. In fact, this is sort of a well-known phenomenon in the medical community that's been known as ACE, or adverse childhood experiences, in which the more trauma or more difficult upbringing that children or people have grown up with, the more likely it can lead to medical problems and mental health problems down the road. Medically speaking, we can often see that chronic physical or psychological pain can lead to depression, whereas depression can also worsen physical pain. Moreover, people who are not sleeping or people who have high amounts of physical pain, they are more likely to commit suicide. So there's a study done in which 30 people with symptoms of depression were interviewed. All of them had a life-threatening physical illness or trauma, like heart attack, cancer, a serious injury, or multiple surgeries. Each of them was asked whether it was the physical pain or the pain from depression that was worse, and which, if forced to make a choice, would they rather live with or experience again down the road. Now, 28 of the 30 actually said that the psychological pain was worse than any of the physical pain that they experienced. Patients described the pain from depression as something that was a deep hurt with waves of agony beyond understanding and a powerful and unshared misery. So it's often the psychological pain that actually drove people to commit suicide. Now, many times people who commit suicide leave a note behind detailing maybe some of the emotional trauma they went through or some of the pain that they're experiencing. And so the same study investigated from a coroner's office what was written in some of these suicide notes from people that have committed suicide. And they made comments such as, "I can't live without my wife. This pain and misery is too much. The pain felt like a heavy-hearted stomachache. The pain feels like it's in my heart. The pain is all over, not centralized. And the pain feels like my heart hurts, a heaviness on my shoulders, hurts in my gut. I just want to sleep." So the question is, how can we treat this emotional or psychological pain? Now, medications can help with symptoms of depression, anxiety. It can help regulate that hypothalamic pituitary adrenal axis that might be unregulated. It can help with the prolonged pain and distress that the body experiences. Therapy can also help to remove some of these negative thoughts, emotions, or feelings that can be distressing someone. And this would be especially important in someone who's experienced trauma in their life, or perhaps the death or loss of someone close to them. But by all means, it's important to check with a doctor or a mental health specialist, especially if one is feeling an emotional distress. There's also resources that one can use, like call the suicide hotline at 988. They can call the emergency number at 911, or they can go to the nearest emergency room or hospital. For someone who may be hesitant to see a physician regularly, like myself, then there may be other approaches that can help to deal with pain or suffering or psychological discomfort. Writing out one's thoughts and feelings that people experience can help them separate themselves from the negativity and also make room for this circumstance to be seen in a more positive way. This is well studied through scientific articles And just 10 to 15 minutes a day of this journaling process can really be therapeutic and helpful. Now, from a Christian perspective, the Holy Bible gives examples of people who have dealt with emotional or psychological pain. We see example during Christ's crucifixion, how Christ dealt with this pain, but we also see it in his disciples, Peter and Judas. In Judas's case, he felt a lot of psychological pain after betraying Christ, and it drove him to commit suicide. In Peter's case, he also betrayed Christ, but he changed his ways and made a notion to do good for others. Basically, Peter was able to help others live more meaningful and fruitful lives. Another biblical example that helps to show how to process some of the difficult thoughts or emotions one is experiencing is through the Psalms. Many of the Psalms are written by David, in which he is going through some sort of agony or suffering or pain in his life, and he presents his thoughts and emotions to God, and by the end of the Psalm, it's often viewed in a positive way. He's trusting in God's promises, or he's saying that God will answer his prayers or save him at the right point of time. So maybe someone finds health and healing through feeling comforted from their distress. Maybe it's medications that the doctor prescribes. Maybe it's going to be therapy from a mental health professional. Maybe it's this feeling of peace or this notion that the person who died is going to be in a happier, better place. Hopefully this helps to just get a better understanding of some of the causes or reasons for psychological and emotional pain, and some of the ways that people can process or get health and healing from it.